On this Friday night, Ontario's new border restrictions with Quebec and Manitoba. As the stay-at-home order is extended, with COVID cases expected to hit all-time highs.
More people are going to die. More people are going to be in the ICUs.
Plus, the younger patients hit by this brutal disease.
My stomach is like paralyzed because of COVID.
A 13-year-old boy shot and killed by police.
Please stop! Stop!
The deadly encounter putting more scrutiny on policing. And the eve of the final farewell to Prince Philip.
He's getting the funeral he really wanted.
But will all eyes be on William and Harry?
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Canada continues to face an incredibly serious situation with this third wave. Cases are rising rapidly. In many cases, in many places, numbers are higher than they've ever been before, and far too many hospitals are stretched way too thin.
Good evening and thank you for joining us. The weight of this wave of the pandemic is hitting hardest in Canada's biggest province. Today, Ontario announced new measures to try to slow the spread of the virus.
It comes down to three things: limiting mobility, enforcing the rules, and getting vaccines into arms.
Today, Ontario shattered another daily record, more than 4,800 new infections. New modeling shows it could get a lot worse, peaking at nearly 20,000 cases a day.
But the biggest problem we now face may be that we're just too tired to notice. So I'm begging you as part of the team to notice. Notice that our hospitals can no longer function normally. They are bursting at their seams, we're setting up field hospitals, and we're separating critically ill patients from their families by helicoptering them across the province for care. Our children's hospitals are now admitting adults as patients, and this has never happened in Ontario before. It's never happened in Canada before.
The strain on the hospitals and those dire projections are forcing the province to finally put in restrictions that doctors have been calling for months. Here's Eric Sorensen.
Restrictions are all around us. The shuttered storefronts, people masked and not gathering in groups, workplaces with safe distances. All the measures so far have not been enough. The sick continue to come in or be brought into hospitals. Many health centers bursting at the seams.
We've never seen ICUs this packed. And the trajectory is still going up.
So the province is now bringing in yet more measures. The emergency stay-at-home order is being extended now to 6 weeks. Outdoor gatherings limited to families only, an exception for people who live alone, and checkpoints at all interprovincial borders. As well, non-essential construction sites will close. Capacity in big box retail will be reduced. Churches will be down to 10 people inside only. And new restrictions on golf and outdoor recreation. Ontario's premier says simply the COVID variants are winning the battle.
The pace of our vaccine supply has not kept up with the spread of the new COVID variants. We are on our heels. But if we dig in, remain steadfast, we can turn this around.
The picture grows more dire. The number of people in Ontario hospitals with COVID virus or variants is now approaching 2,000. Ontarians in intensive care now total over 700, an unheard of number. And yet the projections show ICU cases will rise to 800 soon. And whether moderate measures or new stronger measures, ICU cases are expected to top 1,000 and go as high as 1,500 next month before leveling off.
For the next week or two, those numbers are baked in. That's not going to change. That's the nature of the disease.
Ontario has put out requests for nurses from other provinces. Alberta and Saskatchewan have both said they just can't spare any.
So we just don't have the capacity to start even talking about loaning our healthcare workers out for a period of time to other provinces.
Some are flagrantly ignoring health measures, like anti-lockdown protesters around one gym in Mississauga. But health officials say all Ontarians have to do more and not try to get around health restrictions.
More and more people are sort of saying, I think I can work around this and just play it by ear. A bad decision, and you need to be very careful.
Ontario health officials are calling for more vaccines for high-risk communities and essential workplaces, but that too will take time. The bottom line, case numbers will get worse before they get better. It's unavoidable. Eric Sorensen, Global News, Toronto.
Canadians are just so frustrated over the slow vaccine rollout in this country. Today, the federal government announced it has secured 8 million additional doses of the Pfizer-BioNTech vaccine. That's on top of what's already been purchased. Prime Minister Trudeau says Pfizer will make up the bulk of vaccinations in the coming months. The supply from Moderna will be slashed in half for the rest of April. The pharmaceutical company is grappling with production issues at its facilities in Europe. Canada's initial shipment of the Johnson & Johnson vaccine, about 300,000 doses, is expected to arrive the week of April 27th, and it will be distributed to the provinces at the beginning of May. Vaccination is just part of the solution. Canada's doctors are calling for extraordinary measures to curb the crisis that's unfolding in several provinces. David Akin reports on how the federal government is responding.
Canada's doctors are sounding the alarm.
We're very, very near, if we're not at that point, where dire decisions, gut-wrenching decisions are going to have to be made at bedsides about who's going to live and who's not going to live here.
The crisis may be worst in Ontario, but several provinces are scrambling to deal with rapidly rising case counts. British Columbia is already surpassing all-time highs in terms of new daily cases, hitting 1,200 this week and on its way to perhaps 3,000 a day. And the curve is spiking up in Alberta with more than 1,600 new cases a day now being reported. And in Quebec, there were 1,500 new cases yesterday.
That can't continue. And if what drives that does continue, then yes, those critical life and death decisions will have to be made.
And so the Canadian Medical Association is calling on the federal government to do more, to put stronger public health guidelines in place, to overhaul sick leave programs so that workers who are sick or who are living with family members who are sick can stay home, and to revamp vaccine priority strategies. But ever since the beginning of the crisis, and again on Friday, Prime Minister Justin Trudeau resisted a starring role for Ottawa in favor of playing a supporting role to decisions that he feels provinces have to make.
To help, and what we have said repeatedly to all premiers is that we are there to help whatever is necessary.
On Friday, Trudeau promised to send Ontario federally funded Red Cross mobile vaccination units and other help that he said Ontario had asked for. And yet, Ontario's premier said his province did not need the Red Cross, but they do need more vaccines.
More vaccines means fewer cases. More vaccines mean fewer hospitalizations. And more vaccines means we get out of this sooner.
And there's even talk of Army medical staff being sent in to help overwhelmed hospital ICUs. The problem there, Global News has learned that the Army does not have much backstop capacity, with only 73 critical care nurses available in the entire military. David Akin, Global News, Ottawa.
Tonight, we want to remind you that behind each case, there's a human story. You're about to hear from young people who got so sick from this virus that they didn't know if they would make it, but they did survive. And tonight, they're sharing their experiences with Heather Yerkes-West.
The pain is just incredible. I never had this pain before.
For a terrifying time last week, doctors did not know if Roxanne Smith was going to live or die. The Quebec woman had contracted the B117 variant of COVID-19 and was very sick. She's only 24.
I have 3 kids. The worst thing I can think about the COVID is to die because my kids need their moms.
It's something doctors across the country have noted. This third wave, fueled by highly infectious variants, is hitting young people hard.
I'm with this tube. It's my feeding tube. I can't eat because I'm vomiting everything. My stomach is like paralyzed because of COVID.
Doctors believe Smith is now stable, but she's facing another 2 weeks in hospital and then a long road to recovery. Michael Hawkins has now been sick for 5 months.
I was hospitalized in November, then re-hospitalized at the end of January. I've had several strokes in my brain, as a result of COVID as well.
Hawkins isn't in his 20s, but at 58, he's certainly not elderly either. The Anglican Church bishop has only just become eligible for the vaccine, and he worries about catching COVID-19 again.
I am concerned about catching one of the variants, especially at this stage, or being someone who a carrier of that to others.
Both say they understand COVID fatigue, but when Smith saw people in Montreal protesting COVID restrictions last weekend, she felt angry too.
This variant is very, very affecting the young people, and now it's me, but after it will be another teenager or young woman or young man.
A frightening reality facing much of the country as COVID variants continue their rapid rise. Heather Urix-West, Global News, Calgary.
There's a growing outbreak of COVID-19 in Nunavut. 12 new infections were reported overnight. Iqaluit now has 13 active cases of the virus. Nunavut's chief public health officer says the new cases involve several households, all identified through contact tracing. So far, there is no evidence of community transmission, but cases are expected to rise. The capital was put under strict lockdown yesterday when the city's first infection was confirmed. All schools, non-essential businesses, and government offices are closed. A deadly confrontation between police and a teenager. Coming up, the killing of a boy that's reigniting demands for police reform. A gunman who opened fire at a FedEx facility in Indianapolis killed 8 people and wounded several others. The shooter then took his own life at the scene. And tonight, investigators aren't clear on the motive.
There was no confrontation with anyone that was there. There was no disturbance. There was no argument. He just appeared to randomly start shooting.
It happened late last night. The gunman opened fire in the parking lot before entering the building. The shooting was over in a matter of minutes. Police say the 19-year-old suspect was a former employee at the facility. We're learning more tonight about a deadly shooting in Chicago and a warning. The details and video in this next story are disturbing. Police body cam footage shows a 13-year-old boy with his hands in the air. An officer then fires a shot and kills the teen. This latest case comes as the U.S. is still reeling from another fatal shooting at the hands of police in Minnesota. And as Jackson Prosco explains, both incidents are leading to calls to rethink police training.
19 seconds after responding to a report of shots fired, the officer encountered 13-year-old Adam Toledo.
Stop it! Stop it!
That single gunshot to the chest was fatal.
Stay with us, buddy. Stay with us.
Another camera angle appears to show Toledo put his hands behind a fence before turning towards the officer. Police released this image, which they say shows the teen was carrying a gun. A weapon can be seen on the ground in body camera footage. The family lawyer says the teen's hands were up and empty when he was shot.
That child was given a directive, he complied, he surrendered, he turned to the officer with his hands up, and then he was shot.
Overnight, protesters took to the streets of Chicago demanding reform.
We demand justice.
While in Minneapolis, where the community is still reeling from the police shooting of Dante Wright, families demanded accountability.
How do you keep having murder after murder? We don't have time to recover.
Across North America, policing is under the microscope like never before.
Law enforcement officers are human beings. They can make mistakes. They're rapid cognition mistakes often.
Steve Somerville is a retired Toronto police officer and an expert in use of force and de-escalation. He agrees there's room for change that will save lives.
It's an extremely difficult profession, one that I think we need to look at training to perhaps define an officer's role in attending these calls.
In Washington, there are calls for Congress to pass the George Floyd Act to better track officer misconduct and mandate improved training around racial bias.
That can put in place long overdue reforms that are necessary.
None of that will change the horror that so many families have gone through, nor will it repair generations of mistrust between police and so many of the communities they serve. Jackson Prosco, Global News, Washington.
Still ahead, no answers, no trust, a year after the mass killing in Nova Scotia. This Sunday marks 1 year since the massacre in Nova Scotia. The shooting spree is one of Canada's worst mass killings. 22 people died. Now, a public inquiry into how a gunman calculated and carried out the 13-hour rampage aims to prevent a similar tragedy from happening again. But there's been a long period of silence from officials, and families are struggling to put their trust in the process. Ross Lord reports.
Don and Frank Galenchen had just started what they hoped would be a dream retirement in Portapic when they were murdered, along with 20 other Nova Scotians over the course of 13 hours. 1 year later, Don and Frank's family members are stricken by grief and bewilderment.
Maybe nothing could have saved anybody in that immediate area, but to sleep 6 hours later, 30 minutes away, wake up, do it all over again, how can that happen?
RCMP say the gunman slipped past them and drove out of Portapic in his mocked-up RCMP vehicle by using a different road than the one they were guarding. But other information, such as why an emergency alert was never issued, remains murky. After a series of erratic news conferences, the RCMP promised more details from their investigation.
We commit to providing timely and accurate updates in the coming days and weeks.
That promise, 10 months ago, was the last time investigators faced questions from the media in a public setting. The federal and Nova Scotia governments have established a public inquiry headed by a mass casualty commission. The commission has been assigned to investigate a wide range of questions, including why the massacre happened and how police responded. The commission says its final report, due in November of next year, will include recommendations for preventing anything similar from happening again. For families who are forced to protest in the streets for a full public inquiry, trusting the process is a big leap of faith. They want more information, including details of the alleged role of the gunman's common-law partner, Lisa Banfield, in supplying him with ammunition. Police say Banfield and two others facing charges had no prior knowledge of the killer's plan.
My trust in the inquiry and my trust in the RCMP as a whole, there's none.
They wonder what has changed. There are new measures, including a ban on assault rifles, on the sale of decommissioned police vehicles, and restrictions on used uniforms. But other measures haven't happened, including a buyback on military-style assault weapons and reducing the smuggling of firearms across the Canada-U.S. border. Public Safety Minister Bill Blair's office has declined multiple requests for an interview, and some say the collective silence, with no official date for when the inquiry starts hearing evidence, deepens the level of mistrust.
There was a failure by the state to protect its citizens. So out of that alone, it is a whole range and depth of suspicions that are justifiable.
He suggests it could take a long time to pivot from trauma to trust. Ross Lord, Global News, Great Village, Nova Scotia.
And continuing with that tragedy, tomorrow night on the New Reality, Donna Friesen talks to Gary Clement, one of the leading authorities on policing in Canada, on the crisis of confidence facing the force.
The circumstances in Portapic, the horrible crimes the gunman committed, were unlike anything we'd seen in Canada. Have we learned from that now, do you think? Would a response be different if something so horrific was to happen again today?
We got to realize the RCMP cannot be all things to all people, and if we're going to be more effective, we really should be honest with ourselves, recognize that maybe it's time that we let provincial and municipal governments deal with the policing issue in their own backyard, and let the RCMP deal with the federal, very much like FBI or the Drug Enforcement Administration in the United States.
And you can watch the full report tomorrow night with Donna Friesen on the New Reality right here on Global. Up next, the royal plans to keep two brothers apart at their grandfather's funeral.
You're watching Global National.
Prime Minister Justin Trudeau spoke with the Queen today to offer his condolences following the passing of Prince Philip. Trudeau noted the special relationship the Duke of Edinburgh maintained with Canada over the years, including his close ties with the Canadian Armed Forces. Philip will be laid to rest tomorrow. During a funeral he largely planned himself. It'll be a pared-down affair because of COVID restrictions. The Queen and Philip's children will be front and center, but the drama between two of their grandchildren isn't going unnoticed. Our Europe Bureau Chief Crystal Gumansing is in Windsor tonight.
On the eve of Prince Philip's funeral, his youngest child, Prince Edward, and his family took in the tributes and bright bouquets left as a sign of respect.
Not on the grass, guys. We've got the greatest respect for the royal family, the Queen, and of course the Duke of Edinburgh was part of our lives.
It'd be weird not seeing him around with them anymore.
Yeah.
Prince Philip lived 99 years, and in that time he outlined exactly how he wanted his funeral to unfold and who would attend. COVID-19 has changed some of those plans. Only 30 mourners will be allowed to attend the service compared to the original list of roughly 800. 3 of his German family members will be in attendance, in addition to his children and grandchildren. Prince William and Prince Harry are pulling focus. The brothers won't be walking side by side behind their grandfather's coffin. Instead, their cousin, Peter Phillips, will walk between them.
I count myself as fortunate.
Brigadier General Paul Doyle will be the lone Canadian behind the castle walls on Saturday.
I am privileged and I am humbled and I am just, so proud to be able to be there to represent all of us.
Prince Philip wanted representatives from the Canadian Armed Forces at his funeral. He often spoke of serving alongside Canadians during the Second World War. His years of service reflected in the customized Army Green Land Rover that will carry his coffin. Crystal Gumansing, Global News, Windsor, England.
And we'll have live coverage of the funeral tomorrow starting at 9 a.m. Eastern on globalnews.ca and the Global TV app. And that is Global National for this Friday night. I'm Robin Gill. Tonight, your Canada is the Bay of Quinte in Ontario. Thank you for watching, and I'll see you back here tomorrow. Have a great night.